If you're dealing with an L4-5 disc bulge, there's one mistake that's keeping people in pain for months, sometimes even years. Most people mean well. They're doing stretching they found online, trying to strengthen their core, maybe even resting completely. But they're stuck in a frustrating cycle. Pain comes and goes. They feel better one day, but worse the next. And what they don't realize is this: you can't outstretch or outstrengthen a disc that hasn't properly healed. So what's the mistake? The biggest mistake I see is starting rehab too early without creating the right environment for the disc to actually heal. A disc bulge is a structural problem. It's not just about tight muscles or poor posture. It's about physical compression, inflammation, and pressure on sensitive nerves. But when people go straight into stretching or aggressive movement, especially forward bending motions, they're often making that compression even worse, even if it feels good at the moment. It's like trying to run on a sprained ankle because it doesn't hurt right now. You're only making the injury worse long term. So, what's the better approach? The goal early on should be first to relieve pressure off the disc and let the inflammation subside, and then create stability around the spine. That's when the real healing starts. Disc healing is a slower process because the disc has very little blood supply. This means it doesn't repair as quickly as muscles or joints. Instead, it relies on movement, pressure changes, and time to recover, kind of like how a sponge slowly dries out and then reshapes. This is why rushing into full activity or aggressive treatment too soon often leads to setbacks. One of the movements we often start with this is spinal extension, like the McKenzie press up. You lie on your stomach and slowly press up with your hands and hold for a few seconds and come back down. This helps push the disc material away from the nerves and can centralize the pain, meaning it moves away from the leg and back into the lower back, which is actually a good sign. Another option is walking. Low impact, upright, easy on the spine. It's simple, but it encourages circulation and mobility without adding compression. But even with these strategies, some people still struggle. Why? Because their disc is too compressed. The space between vertebrae is narrowed, and no amount of stretching or exercise will physically take the pressure off that disc. And this is where most people hit a wall. They've tried all the stretches, done the exercises, maybe even gone to physical therapy, but they're still not healing because they're missing one crucial piece: decompression. Most people don't even know it exists, but non-surgical spinal decompression is one of the most effective and overlooked treatments for lumbar disc bulges. It gently stretches the spine in a way that creates negative pressure on the disc, almost like a vacuum. That can help pull the bulging disc material away from the nerve root, giving it a chance to heal without surgery, injections, or long-term medications. Now, just to be clear, this is not an inversion table or generic traction. This is a specific computer-controlled table that targets the exact spinal level with controlled tension and rest cycles, building up to create measurable disc relief. It's one of the most powerful tools we use with disc patients, especially when nothing else has worked. Let me tell you about my patient, Jack. I first met Jack late last year, and at that time he had been suffering with chronic lower back pain with numbness and tingling that shot down the back of his right leg. He had been dealing with this pain for over 4 years after he slipped and fell on his tailbone. Prior to seeing me, he had seen multiple other doctors for a pain. He had had an epidural steroid injection that only helped his symptoms temporarily. He was living every day on Advil and Tylenol to have to deal with the pain. And he had even been prescribed gabapentin, which didn't help his pain level at all. And this numbness and tingling in his leg and the lower back pain kept him from doing simple tasks like walking for more than a few minutes, which made things like grocery shopping excruciating. So when I met Jack, we did a full examination and took x-rays. And based on this, I was able to determine that most of his symptoms were coming from a disc bulge in L4-5 and L5-S1. After beginning treatment, which began with chiropractic adjustments and a combination of spinal decompression, we were able to start to relieve the pressure off that disc. And after a few weeks, he had a 50% reduction in pain level. Fast forward to a few months later, and he was back to walking and doing basic tasks like grocery shopping without pain, and had finally gotten his life back after trying epidural steroid injections, after trying pain medications. But with a combination of chiropractic care and spinal decompression, he was able to get his life back. Now, a lot of people are told that once they have a disc bulge, it'll always be there. That's not true. In fact, studies show that a large percent of disc bulges reduce in size or even resorb completely with the right care. The key is reducing the pressure and inflammation long enough for the body to do its job. So here's what recovery usually looks like. In phase 1, it's the relief and stabilization phase. The goal is to reduce pressure and inflammation. And to get there, we use tools like decompression, walking, McKenzie-style extensions, and chiropractic adjustments. Phase 2 is rebuild and retrain. During this phase, the goals are to restore function and help support the spine. To accomplish this, we use core activation, postural correction, safe movement patterns, and chiropractic adjustments. And then the third phase is prevention and progression. The goal during this last phase is to get you back to doing what you love without the fear of re-injury. To get there, we work on long-term strength education, lifestyle adjustments, and chiropractic adjustments. You don't need to rush through these phases. You just need to take the next right step. The truth is, disc healing takes time, but also takes a strategy. If you're still chasing quick fixes, doing random stretches from the internet, or stuck in passive treatment cycles that don't address the root cause, you're not giving your disc what it needs to truly heal. So, here's what I would recommend. First, avoid forward flexion, especially in the early phases. Number 2, focus on stability, not flexibility. Number 3, add spinal decompression to help relieve disc pressure. 4, then and only then, begin targeted movement and strengthening. If you've been stuck for months and not seeing progress, this could be the real missing link. If you found value in this video, feel free to like it or share it with someone who's dealing with this kind of pain. It might be exactly what they're looking for right now. And if you're wondering, do I even have a disc problem, or could this pain be coming from my SI joint instead? That's a critical question to ask because the treatments are completely different. I made a separate video that walks you through a quick, easy self-test to tell the difference. Watch this now, especially if your leg pain hasn't responded to what you've tried already.